followed by a panel Q&A on how each pharmacist makes their practice work. At the end of the presentation, we will take questions from the audience. Before we begin the webinar, I'd like to announce a number of housekeeping and technical tips. We will be using Zoom webinar. Attendees cannot speak, but we encourage you to use the Q&A box in your Zoom controls to ask any questions. Any technical or administrative questions will be answered by our technical support team. The session is not accredited, but we will provide you with a follow-up email confirming your attendance if you need it for your own learning needs. The session is being recorded, and the recording will be available in our webinar library within a week, along with a copy of today's slide deck. Finally, when the session is over, please take a few minutes to complete our online feedback survey. Community pharmacists are uniquely positioned to function as health hubs, entry points for patients who need advice, advocacy, assessments, and triaging. This is more important than ever in rural communities where the local community pharmacist might be the only healthcare provider available. Recent statistics indicate that 14.5% of Canadians do not have a regular physician. Pharmacists play vital roles in chronic disease management, immunization, and disease prevention. The pharmacy as a healthcare hub reinforces these important roles. We are pleased to have 3 presenters today who have embraced this concept and will share their experiences. Our panelists today are Stephanie Burden, Caitlin McGrath, and Taranam Movavetti. I will ask each of the panelists to introduce yourselves to our audience today with a few important facts from your bio. So Stephanie, if I could turn to you and have you introduce yourself, that would be great.
Thanks. Good afternoon, everyone. My name is Stephanie Burden, and I am a community pharmacist and pharmacy owner in Rocky Harbour, Newfoundland. I have been a rural community pharmacist ever since I graduated from pharmacy school from Memorial University in 2009, and I moved back home to work at our local pharmacy. And after 6 years of doing that, I started pursuing my PharmD at the University of Toronto, and I was fascinated by the world of opportunity out there for pharmacy. And so I left my job and I built a greenfield pharmacy just down the road so that I could create my own practice based on this healthcare hub model that we're going to talk about today. While building my pharmacy and my practice, I completed my PharmD and I'm set to graduate in just a few weeks. I'm very fortunate to live on the beautiful west coast of Newfoundland. I'm actually from a very small town in rural Newfoundland. I'm from St. Paul's, which just has a population of less than 300. And I love Newfoundland. When I'm not at the pharmacy, I'm very much an outdoor enthusiast, hiking and paddling and snowmobiling and snowshoeing with my husband, Craig, and our golden doodle, Lucy. So I'm excited to be here today.
Great. And Caitlin, over to you.
Good morning or good afternoon, depending on where you are. My name is Caitlin McGrath. I'm a pharmacist and the store operator at Tellier Pharmacy in my hometown of Bonnyville, Alberta. Bonnyville is a rural community about 3 hours northeast of Edmonton. We have a population close to 6,000 people. As I mentioned, it is where I grew up, and I graduated from the University of Saskatchewan in 2017, so fairly recently, but I've spent the duration of my career here at Tellier's, and my role has progressed now into a management. We're so fortunate practicing in Alberta to have the expanded scope that we do, and my dedication to my community has really been focusing on creating a healthcare hub, utilizing our expanded scope of practice, and providing exceptional patient care on a daily basis.
Great. Thank you. And over to you, Taranam.
Hi everyone, my name is Taranam Movavetti. I'm a 2018 grad from the University of Toronto. I currently practice at Whole Health Pharmacy as well as Intrepid Health Group in Brampton, Ontario. I've been working here for the past 2.5 years, and we've really been focusing on expanding our scope of practice and creating a hub for pharmacists and physicians and other allied healthcare providers to work closely with one another. And that's what I'll kind of be talking to you about today.
Great. Thank you for that. I'd like to pass the floor over now to Stephanie, who will describe her practice in Newfoundland.
Here we go. Thank you, Phil. I am so excited to be here today to chat with you about the healthcare hub model. I believe that we can look at this model through a few different lenses. So first of all, we can look at it from a pharmacy business perspective. So moving from a product-based business to a service-based business. We can also look at it through the lens of contribution. So pharmacists and pharmacies' contribution to the greater healthcare system. And we can also look at it through the lens of professional satisfaction, which is really what I want to talk about here today. Because the truth is that 7 years ago, I was actively looking for a different career. And it's incredible that through this healthcare hub model, I've been able to move from a pharmacist who felt like they weren't making an impact on a day-to-day basis to being named the 2021 Canadian Pharmacist of the Year. So this is a model that I truly believe in. If you are a pharmacist who is tired right now of the way that you are practicing, or if you are a pharmacy owner and you're down in the trenches and you can't see the forest for the trees, then this presentation is absolutely for you, because I want to show you today that you have all of the tools that you need to start creating your own healthcare hub. So let's get started. Oops. I think in order to know where we're going, we have to realize where we came from. And so when I graduated from pharmacy school 13 years ago, I strongly believed that I would be part of the circle of care, that we would be a cog in the wheel, so to speak, that we would be getting calls from physicians and healthcare providers on a daily basis looking for recommendations. And once I got out in the real world and started working in community pharmacy, I realized it wasn't really like that. Community pharmacy was actually the end of the line. And so what I discovered was that we really only had opportunities to speak with other healthcare providers when we identified a red flag. So in 2016, I wrote this business plan and I dug it out for you because in this business plan, I described my ideal practice as a healthcare hub. And this is a visual representation of what I believe the healthcare hub to be. And at its core, what it is the pharmacy and the pharmacist is the connector for the healthcare system. We help to close up the gaps, and using our toolbox, we could be invaluable and dependable to our fellow healthcare providers and to our patients. And the tools are really just one part of the equation. The conversations and the connections that we make are really what brings this model to life. So from that business plan came this pharmacy. So welcome to Complete Care PharmaSave in Rocky Harbor, Newfoundland. I wanted to create a place that people felt comfortable coming into. It was inviting. People felt confident when they came in, and they really wanted to have the opportunity to speak with the pharmacist. You'll see that our pharmacy doesn't have any product in front of it, and that's because I wanted to convey to patients that this was a professional clinical area, separate really from the sales floor. What I've discovered as I look at it today is really what we created was a primary care facility. So we offer primary care and health promotion. And growth of our business came through word of mouth and the patient experience. I think it's important to note here that we don't do anything astronomical at this pharmacy. We are doing and offering a lot of the same services that you're probably already offering or that you have the ability to offer, like blood pressure checks and medication reviews. We just do the ordinary things, but we do them extraordinarily well. And we expand what a patient expects when they come to the pharmacy. So let's talk about those patients who walk up to your counter, because every patient is an opportunity. And what we do well and what we do differently is that we don't just offer services. We don't just have a menu board of services that you can avail of at our pharmacy. We actually connect patients to services through our conversations. So we don't wait for a patient to come in with a bag stuffer and tell us that they want blister packs. We instead have conversations with our patients. We identify patients who may be struggling with their medications, and then we offer them the solution of blister packs. We read between the lines when a patient maybe doesn't feel well, and we pull them in and maybe do a blood pressure check or a blood sugar check and help them learn what those numbers mean. We have conversations with every patient, and then we open our toolbox to see how we can best serve those patients. So let's talk about that toolbox, because this is what I believe that most pharmacists would think of when they think of their toolbox. And this is a great place to start. But I want you to start thinking bigger than you have before. If you're going to fill in the gaps, if you're going to be a clinician, then you need more tools. And this is what my practice looks like. Now, we're not just a dispensary. We're a primary care provider. I focus on health promotion and patient education, and I fill in the gaps for providers. So I can give a physician a weekly blood pressure check for a patient that they're titrating on antihypertensives. I can make an informed decision about a minor ailments prescription using the labs that I have access to, and I can validate an indication using clinical reports. You have all of these tools at your disposal to start creating your own healthcare hub. It may take a little bit of investment from a business perspective, but it's mostly about rethinking your practice as a clinician. Are there going to be challenges? Absolutely, there are challenges. If there weren't challenges, it wouldn't be as rewarding. And for us, one of our challenges is our rural geography. We're located in Newfoundland, but we service patients up to 90 kilometers away from the pharmacy. We offer a daily delivery. And so while that's a challenge, it also sparked creativity, because no matter how inviting our pharmacy is, we're not going to get every single patient in for a blood pressure check. Which got me thinking, well, how can I give all of my patients the same education and experience if they don't walk in through my doors? And that's really what sparked my social media. I am a patient educator at heart. That is my core skill, and that is what has helped to build this business. And by using social media, I have been able to meet my patients where they are. So if that's on their lunch break or in the grocery store lineup, I've been able to offer them health promotion and education right where they are. And so now I'm not just able to get out from behind my counter, but I'm actually able to get out from behind my entire four walls. So don't be afraid to do something different, because it might just be the thing that changes your whole practice. So anyone who knows me knows that I really like to give some action tips. So if you are the pharmacist that really wants to start incorporating this, or the pharmacy owner, I'm going to give you 3 quick tips. Number 1 is to use your counseling room as much as possible. Don't save it for awkward conversations. Pull your patients in as much as you can, and that gives you an opportunity to have those conversations and make those connections. Number 2 is about offering solutions and connecting with other healthcare providers. Don't throw a ball back in someone else's court if you don't have some options and some solutions to go along with it. Open up your toolbox, come up with a plan, and then offer that. And you'll start to see that you can showcase what a pharmacist can do and the positive impact that a pharmacist can have on the practices of other healthcare providers. And then number 3, this one is super important. Start seeing your prescriptions as patients, not as pills. So today, when you check a bottle of rosuvastatin, don't look at it as rosuvastatin. Start looking at it as a patient who has dyslipidemia. Maybe go check their labs if you can and see how is that dose of rosuvastatin working for them. And then if you identify something, have a conversation with the patient. Are they having side effects from that? So, I'm really excited to share this concept with you. It is something that I've believed in for a very long time. And so if I've talked about something here today that has sparked your interest and you'd like to talk to me about how you can start building your own healthcare hub, by all means, you can send me an email. I'd love to chat with you on Zoom. If you'd just like to follow along with my practice, here are my social media handles. You can follow along. Thank you very much for the opportunity.
Great, thank you for that, Stephanie. That was fabulous. I'm just going to keep my camera off. I'm having a little bit of a choppy Wi-Fi connection right now. But Stephanie, I have a follow-up question. That your presentation was excellent, and I just was wondering if you can share with us a situation, perhaps a patient scenario, where you've leveraged your scope and also your practice model to help a specific patient.
Yeah, so a patient that comes to mind, and I think it speaks to not only the pharmacist's role, but the entire team's role. So we did have a patient, he had come in and he had spoken with the pharmacy assistant, and he had asked for a printout for a drug he was taking, gabapentin. And he'd been taking this medication for a while, and so my assistant, she knows how we operate, and she also read between the lines, and she thought, you know what, just hold on, I'm going to grab Stephanie for you. He felt that he had been having some side effects. And so instead of just handing out that printout, just printing it off and giving it over the counter, I pulled him into my clinic room and we had a conversation. And instead I decided, I don't think that you're having side effects from this medication. I sent him to the hospital and he ended up having a pacemaker. But I think the important thing is if you don't read between the lines, then you'll miss something. And had we just given that patient that handout for gabapentin, he absolutely would have seen his symptoms in that handout and probably would have thought nothing of it and probably thought it was just the gabapentin and stopped it. So I think seeing the bigger picture as a complete team, not just one pharmacist, is really important.
Right. That's excellent. I love that story. I think, yes, pharmacists, we're often humble about what we do, but when you think about some of the outcomes and some of the situation that you potentially prevented, it's really quite awesome what an impact pharmacists can have. What I'd like to do now is pass the floor over to Caitlin, who is going to describe her practice.
Right. Thank you so much, Phil. Thank you, Stephanie, for sharing as well. So inspirational to see your practice and so many tangible points to implement into our own. So as I mentioned, my name is Caitlin McGrath, and I practice in rural Alberta in my hometown of Bonnyville. You can see my store here, Tellier Pharmacy, within the Rubicon Pharmacy family. So within my practice, I have 4 pharmacists, including myself. We all are locally grown, all from the Bonnyville area. We have 1 registered pharmacy technician who is also from the community. And we also have many phenomenal pharmacy assistants and 1 pharmacy student. Again, that's a product of our community. We're an all-female staff, and we focus on offering local care with compassion and a team approach. Intra-professionally within our team, utilizing everyone to their full potential, and interprofessionally with our colleagues within the community. We focus on providing optimal medication therapy, a safe place for questions to be answered and for care to be provided. Our pharmacy has also been in our community for over 50 years now, and we've really re-solidified our role in the community and in healthcare for our Bonnyville patients to make sure that they are receiving the best care possible as our scope of practice grows and as our practice develops. So our practice as a healthcare hub, we really focus on our clinical services. And as you can see, and as most are aware, Alberta is fortunate to have the broadest scope of pharmacy practice within the country. And my pharmacist and I really strive to provide care plans thoroughly, as well as prescribing when appropriate, immunizing, and referring to our colleagues. Many community members within Bonnyville do not have a primary care practitioner. So oftentimes the pharmacist is the healthcare professional offering the continuity of care. We utilize our clinical services to truly get to know our patients. We use it as an opportunity not just to review their medication, but to review with them what their healthcare goals are and create those targets and how we can achieve that. We allow for documentation and follow-up thoroughly through these clinical services to unify our pharmacy team's approach and really integrate that collaboration amongst ourselves. So if I'm not the pharmacist on staff, my colleague can pick up wherever I left off, and we can send that documentation and continue that dialogue with the rest of the care team. Pharmacists are often the first point of contact into the healthcare system with our community. We don't always have a walk-in clinic open. And as a result, we often have people walking in the evenings or on weekends, holidays, when a physician or a nurse practitioner may not be available. We use our full scope of practice to ensure that there is that continuity of care and ailments are being addressed and questions are answered in a timely manner. With that, though, we also recognize the limits of our knowledge and expertise, and we're utilizing our network of physicians, dietitians, physiotherapists within our community to connect patients to those that have the extended skill set and work collaboratively with them. We use our clinical knowledge and expertise to increase healthcare accessibility, and that goes hand in hand with health equity as well. We use our continued interprofessional collaboration with our primary care network to advocate for our patients when appointments aren't available soon enough, or there needs to be that connection with the rest of the team. We're also fortunate to have education programs within our community, and we use our practice and our care plan abilities to help refer our patients to these educational programs while offering patient education ourselves. Accessibility can be a struggle for any rural community. Pharmacists are the most accessible to triage patients and help advocate for their therapies with frequent visits. I'm sure most pharmacists have, patients that come almost weekly or call very often. And we're so fortunate to take those relationships and really grow with them and be that advocate and that source of care, and oftentimes just a calming voice of reason to help them navigate the system. One thing that we really pride ourselves on is the Simple program. So being a part of the Rubicon family, which has many different stores in Western Canada operating under 6 different banners, the Simple program is our brand connection, offering quality care with a strategic relationship tool. So being innovative to collaborate amongst our team, using our assistants, our registered technicians, and our pharmacists to the full extent to organize our workflow by simplifying patients' medications and by synchronizing them, offering compliance packaging and removing that stigma around compliance packaging, helping the patient to feel empowered for their health and what their pharmacist can do to help them. Our patient relationships are the meat and potatoes of our practice. We believe in care over commerce, and the connection, compassion, and familiarity offered at our pharmacy is really what keeps our patients coming back and keeps us connected. We listen to our community needs, and we really try to respond to that. A perfect example is when it was announced that pharmacists could administer COVID vaccines, and when the criteria extended to educators, we were able to connect with our local schools and advise them that they could receive the vaccine through us, another pharmacy, or public health. And that really was a testament. I was so proud of my staff for taking the initiative to recognize what the community needed and go from there. So I've said this many times within my practice, we are community pharmacists working in a community pharmacy. We're so essential in our communities that it's right there in our titles, and we need to take pride in that. We connect to so many patient demographics, to so many other colleagues, and we now have such a virtual platform that we offer Tellier tips on our Facebook page to help start a conversation and notify our patients exactly what we can do for them. We've kept our doors open and remained accessible day in and day out through a pandemic, and it's helped us to pivot to be more accessible than ever. If anything, we almost feel more connected to our patients. Our continuity of care is something we pride ourselves on, ordering and interpreting lab work, prescribing, ensuring thorough care plans, and that follow-ups are done regularly with our patients. We use our staff to its full potential, intra-professional collaboration, as I mentioned, empowering our technician to use her full scope, and our pharmacy assistants to really take on the work that they can so that the pharmacist can integrate themselves even more clinically into our practice, into the patient's care. In the one picture on the left, you'll see a Christmas hat and a bunch of bags. The other piece within our community, within our practice, is our community involvement. So I'm very happy to say that we have done community volunteering initiatives as a pharmacy staff, and we did that at Christmas time, delivering meals to seniors. And it's one of those things that really brought us together as a team, but then also helped us to really integrate into the community even more. Additionally, we pride ourselves on investing in our youth. So I'm a product of the work experience program. I started at Tellier Pharmacy when I was just 15 years old, and I never would have been able to spark my passion for the profession had I not been given that opportunity. 3 of the 4 pharmacists within my practice started that way. My registered technician started that way. And my first year pharmacy student started that way. So really investing in our community by giving the youth opportunities to see what the pharmacist can do and the potential that we have to impact our community's health. And so much of our practice is giving back to the community that gave us so much growing up. So I have my 3 points in summary of how I integrate our pharmacy practice into the community and really truly act as a healthcare hub. Connection, making sure our practice is patient-centered and that we have a team approach amongst our own staff, but then further into our interprofessional relationships. We really strive to foster that sense of community behind the counter, but then also in our front store, making sure that we are a community hub as well as a healthcare hub. Collaboration amongst our team with our other professionals and really focusing on the patient at the center, and compassion. Ensuring that there's that continuity of care, being accessible, making sure that our patients don't slip through the cracks and we can answer their questions and connect them to the points of care that they need if it's beyond our scope. And ultimately, treat the patient, not the prescription, not the condition. Get to know your patient, get to know their story. We're so fortunate to be connected within our community and see our patients as our neighbors or community members that we grew up with. And I think if we keep that perspective that that is someone's mother, grandmother, daughter, father, then that really helps us to guide our compassionate care as a healthcare hub within our community. Thank you so much.
Great, thank you for that, Caitlin. Just a very quick follow-up question, and that is that you obviously have a clear vision of what you want to do for your clients and how you want to help them. And also in Alberta, you have the most advanced scope of practice in Canada. And I'm wondering if when you interact with other healthcare professionals, other prescribers, have they always responded positively with what you're trying to achieve in your practice, or have there been cases where it's been a challenge sometimes, and how have you managed to convince them about what you're doing and how you're optimizing patient care?
No, that's a great question. I think that comes up time and time again as we take on more within our scope, that it does, I guess, leave some other professionals uneasy at times. But I think it comes back to that connection with other professionals. And not to say that we have to prove ourselves, but being transparent in terms of we're focusing on the patient. And as a pharmacist, we have that clinical knowledge and expertise to help advance the patient care. We can't all be in every place at once, and that goes for all practitioners. So really re-solidifying that team approach and that thought process that we are here for the patient comes first, and we're not trying to step on toes, but we're trying to make sure that care occurs in a timely manner, in a professional manner, and it's done to make sure that the whole team is aware. There's that constant communication and documentation that as long as we're transparent, of course, there's going to be bumps along the road. But if you keep the honesty and the patient at the forefront, I think it's usually well received.
Great. Thank you. Thank you for that, Caitlin. That's excellent. I'd like to pass the floor on to Taranam, who will describe her practice.
Okay, guys, so I'm going to talk a bit about my practice. So like I mentioned, I'm a 2018 U of T grad, and currently I'm working what I call a pseudo family health team environment. So I'm pretty lucky considering that in Ontario, we don't really have as much of an expanded scope practice compared to Alberta, for example. However, where I work, we've tried to kind of utilize a hybrid model by combining Intrepid Health Group, which is our clinic side, with Whole Health Pharmacy, which is our pharmacy side. And so that's why I refer to it as a pseudo family health team environment, because it's not really a family health team, but the way we practice, it's like a family health team. So as part of our team and our circle of care, we have all these different healthcare providers. So pharmacists, of course, we have our family doctors, we have specialists, so internal medicine, gynecology, pediatrician, cardiologist. And then we also have a dietitian, which is really important for our chronic disease management patients. And then we have our other allied health care providers, so audiologists, physiotherapists, sports medicine, massage. So this is all in the same building under the same roof. And so that's why, you know, I see our clinic and our pharmacy as a healthcare hub. So some of you might be wondering how this came about. How did we kind of create this health hub? Considering we are a community pharmacy, and so how can we have all these different practitioners working? As part of our plan, we kind of recognize that, especially in Ontario, the healthcare system is really fragmented. So if you work in a community setting, you don't really have access to lab work. You don't really have any consult reports. You're kind of just dispensing, and it seems to be like a blinded way of dispensing. You don't have all the right information that you need to make that assessment. Is this dose appropriate? Why is this dose even changed? Is this drug even safe for this patient? What's their eGFR? What's their A1C? And so we kind of recognize that we need to inform a kind of work environment where we do have access to that. And so this opportunity came up to kind of have a pharmacy plus a clinic operation under the same roof. And it's from there that we kind of grew. So we started off with just family doctors. Then we started adding specialists and dietitian and physiotherapists. And so slowly we started to add all the different healthcare providers. And that's where we are today. To begin with, our role wasn't, as a pharmacist, our role wasn't as involved as it is now. To begin with, we just had directives for a couple different tasks, such as INR management and warfarin dose adjustments, as well as travel vaccine prescribing and administration. And then based on that, once we started to kind of build that trust with all the different healthcare providers, that's how we kind of grew. So this is my current role. I'm the clinical pharmacist on the team, and my role is as stated. So I do a lot of things that are under medical directives. So for example, I do warfarin dose adjustments when the INR comes in. I do travel vaccine clinics prior to COVID under a medical directive. We do a lot of chart reviews and medication reviews based on lab work. So I'm pretty lucky, again, in Ontario to have access to lab work. So I have access to the EMR, I have access to the doctor's notes, the consult notes from the specialist, any sort of imaging, any sort of lab. And based on those chart reviews, that's how I make my recommendations. And from those chart reviews, there will be situations where you can do a medication review, you can write a pharmaceutical opinion. And from those is where we kind of can actually get reimbursements. So sometimes the work I do, there is no reimbursement from it. It's just for the patient to optimize patient therapy. But some of them who do qualify, that's where kind of the revenue is generated from, pharmaceutical opinions and med checks. I also have a lot of involvement with actually identifying patients that will be good candidates for referrals. So like I mentioned, we have internal medicine specialists, we have dietitians and a cardiologist on our team. So I have a really, I have to keep an eye on that and who would be a good candidate. And then based on that, I can recommend it to our family doctors to create those referrals. I do a lot of drug information, answering questions for our physicians. So, I'm kind of like drug information specialists on our team. They will text me, even if they're actually working elsewhere at a different clinic or even in the ER. We've kind of built that relationship where they will text me to ask any questions that they have. And then I think one of the most important things that sometimes it's good for patients is that as a pharmacist, I know what's covered and I know what isn't. So oftentimes when the physician prescribes something that's not covered by ODB, so Ontario Drug Benefit, it's just so easy for me to go up to the physician and say, hey, I think we should switch this to this because the patient's not going to take it if it's not covered. And I think, combining all of these different tasks that I do, I'm actually able to be a health hub for our patients, because it's not just dispensing medications, but it's so much more than that. And it's identifying, what the patient could benefit from, a referral or a dietitian, the things that normally in a regular community setting, you wouldn't really be involved in. So some of the keys to our success, what I think these are the top ones. I think hiring the right people is very, very important, because you kind of want the pharmacists and physicians to have an aligned vision. You want them to be on the same page. You want them to have a collaborative approach, because if they're not, then it's much more challenging to do so. I think oftentimes where you will come across healthcare providers or physicians that are kind of like not trusting, I guess, at the beginning. So I think when you kind of focus on identifying or showcasing that the patient's outcome is your priority, and you're both there to help the patient, you know, become better at their taking their medications or have better outcomes for their A1C or fasting blood glucose levels. When you identify that both of your goals are the same, which is the well-being of the patient, that's when the trust will actually begin to form, and then you can actually grow on that. I think as pharmacists, especially in Ontario, sometimes we fail to utilize our scope of practice to the max. I think that's really important, and I always mention that to our students. You know, you have to become comfortable in adapting prescriptions or extending prescriptions or administering vaccines. And I think once we start to utilize our scope of practice to its full, then we're actually able to provide much more recommendations as well based on that. Being proactive is very important. So I think, you know, what I always do is I always review the charts ahead of time. I always know, okay, these patients are coming in today to see one of our family doctors. I go through all the charts. I look at all the notes and all the lab works that been, you know, recent. I look at the medications, and proactively I make recommendations. And I think that's very valuable to our physicians, because it's kind of made their life easier too. I've already identified A1C is elevated. You know, maybe we can increase the dose of metformin. And so the part of their work is also done for them, and I think they start to appreciate that as time goes by. And of course, staying on top of your clinical knowledge. I think it's really easy as a pharmacist to just, you know, be comfortable where you are, but continuing to read, continuing to attend webinars or seminars, conferences is really, really crucial. And I think that's all for now. This is my information. If any of you have any questions, I'd be more than happy to answer them.
That's really great, Taranam. Thank you for sharing that with us. I did have a question that I was on my mind going through your presentation, and that is, you know, we hear sometimes about doctors who say, well, we don't really know what pharmacists do. And I'm actually quite shocked when I hear that. But as a pharmacist, you know, you sort of take that comment really to heart. And you've mentioned how important it is to build trust with those physicians and other providers within your practice. How do you go about telling them all those things that you're capable of doing? Like how do you convince them, you know, for example, with an A1C that you can respond to that and suggest a change in dose or a change in medication? How do you sort of broach that discussion with them as to what you can do?
Yeah, so I think, to be honest with you, when I first started at this role, this wasn't my specific role. Okay, so we only really had INR, and we only really had like travel. It was the beginning of travel vaccinations. I think slowly I started to like maybe slower cases, like smaller cases, maybe just making one recommendation like per week, right? I slowly started to increase that. And by doing that, I kind of saw them change their behavior and change their perspective, because I was able to see that they were kind of appreciative. They're like, oh, actually, yeah, that's a good recommendation, you know? So once they saw that part of their work is being done for them, it was kind of, that's what started to convince them. And then again, when they see that your knowledge is up there, you're able to provide, you know, clinical trials or guidelines, and you have backup for your recommendation, then they kind of start to trust you even more, because then they're like, oh, okay, well, Taranam knows what she's talking about then. So, you know, that kind of started building the trust there. Again, it has to be slow. I think we're very lucky because, again, we've kind of hired the right physicians because they're aligned with the vision that me and my bosses have. But again, even then, it still does take time. And I think just taking it slowly is the best approach. And then just trying to show it with the work you do, rather than saying I can do it, just showcase it.
Great. Excellent. Thank you for that. This next question, I think I'll address to all of our presenters today. You've given us a lot to think about. And you know, one thing that we've heard is that Canadians have had a lot of difficulty accessing healthcare during the pandemic. Things have become much more complex, more difficult. And what the thought that has gone through our mind is that your practice models seem to be ideally suited to a situation like this where we have a crisis. And so I'm wondering if perhaps starting with you, Stephanie, if you can describe to us how, whether the pandemic has made your practice even more vital than it was before in serving your community.
Absolutely, Phil. So I've said often that COVID has made me feel more disconnected from my patients than before. But what it has done is really shown patients how important a pharmacist is on their team. Because as we're operating as a healthcare hub, then we've been probably the place that continued to provide some primary care when maybe other healthcare providers were focused on secondary care. So patients knew that they could still come into the pharmacy. If they were really feeling unwell, they could still get a blood pressure check and things like that. So we were really dependable for patients. And I think that that has certainly elevated the community's vision of what a pharmacist is and what a pharmacist can do for them.
Great. Excellent. Thank you. And Caitlin, how about you? How has the pandemic affected your practice and how has your practice actually responded to that?
I think for our practice, it's really re-solidified our place in the community and as a pillar of support, especially during a time of so much uncertainty and fear. Our phone calls were increasing and people were turning to us as their point of reliable information. And time again, we were answering those questions, giving people peace of mind and just being there for them. And even when other clinics per se had gone strictly virtual or by telehealth, we still stayed open so that our patients could physically come in. And I mean, it wasn't always easy. There's definitely challenges with that, but we really pivoted and made sure that we were even more accessible than ever. And I think it's a testament to our profession. We really showed up. We didn't really wave in any fear. We were the ones that continued that care and that connection. And we used our connections within our community to connect our patients even further to the telehealth options. And they knew that they could still come to us in person as well.
Great. Excellent. And Ternam, how about you? How has the pandemic affected your practice and the crucial importance of it in your community?
Yeah, so I think mine's a bit different to Caitlin and Stephanie because they're in smaller cities. So we actually launched a virtual clinic during the pandemic. So we created a new virtual clinic for Ontarians. And so my practice actually kind of changed during the pandemic because our physical clinics weren't open. So I was actually managing our virtual clinic for a year. So it's kind of different, but again, it was kind of another source for our patients to get the help they need. And we had pharmacists on the team at Cover Health as well. So it was a bit different to Caitlin and Stephanie's stories, but again, it was just a matter of things that shifted virtually compared to being in person and them coming in. We did a lot of virtual stuff, utilizing apps, video calls, all of that.
That's great. Thanks. Actually, and further to that response, Ternam, can you describe how you leverage technology in your practice? How you make that a part of what you do?
Yeah, so it's kind of been challenging because oftentimes in pharmacies, our patients are elderly. So, getting them to do video calls for a medication review, it can be challenging. But what I've tried to do is me and my students try to do phone calls if they're not very tech savvy or they don't have a phone that has a camera or a laptop. But we've been utilizing apps such as MedMe. So we use MedMe for our pharmacy team, which we love. It's really, really user-friendly. And then our physicians use Cortico, which is another app. So all of us have kind of had to adapt because we normally wouldn't have apps, to use. So it's been a steep learning curve for both patients and us. But I think at this point, like everyone's used to it, and some patients actually like it even more because it's easier. They're at work and they can do a virtual consult. So yeah, we've had to kind of use and learn the new technology and adapt to that because it's very different, as well as how you talk on like virtual platforms is very important because you're not there, the body language is different. So that's also, I think, for me has been a learning curve.
Mm-hmm. I can imagine. How about you, Stephanie? Do you use technology? Do you leverage technology at all in your practice in terms of communicating with patients or in other ways?
Probably our biggest use of technology is just through Facebook, through social media, because that's where a lot of our patients are. That's where we meet our patients. When it comes to day-to-day practice, we don't use a lot of apps and things like that, other than references. But probably still my tried and true piece of technology is my fax machine, because that is how we connect. We are not all under the same roof. So I'm a standalone pharmacy, and then all our healthcare providers really operate all in silos. So the doctors are in separate clinics, and the community health nurses operate out of a different office, and then they're often in the field. So connecting through the fax machine is probably like my most reliable piece of technology that I use every day.
Excellent. Great. Thanks. Caitlin, this question is for you, and that is, how do you support chronic disease management in your practice, and in terms of, how do you prioritize patients to do more of an in-depth dive into their chronic disease states and some of the services that you can provide for them as a result of that?
Yeah, that's a great question. So a big part of our practice is care plan development, taking the time to sit down, get to know our patient, really dive in, utilizing our scope in terms of reviewing lab work, and discussing those outcomes and options and monitoring, and creating a thorough follow-up plan as well. Our Simple program really helps us as well in managing our chronic disease patients and ensuring that they have that continuity of care, giving them many different options in terms of how we can package their medications, and scheduling that monthly phone call to have that follow-up. So they know that if they maybe forgot or they meant to call us, but it just slipped their mind, that they're going to have that monthly phone call. And for us, our tried and true is the telephone. We love calling our patients and having that connection. And I find that Simple has really enabled us to do that, organizing our prescriptions ahead of time for people, addressing their questions before refill. And they don't have to sit and wait. They come in, pick up, and they know that they can have that further clinical consult with the pharmacist when they come in to pick up their prescriptions.
Okay, excellent. That's great. And Stephanie, I think that I direct this question to you, and that is to delve a little bit deeper into the whole area of human resources. You are obviously passionate about the practice that you've created, and so the question is, how does the composition of your team impact your model of care, and is it, have you always felt it easy to get all of your staff on board with what you're trying to achieve and your vision? Have you had challenges sometimes with getting everybody to acknowledge the importance of your practice style?
Your team is super important, because as a pharmacist, you are just one person. You are not going to be able to create all of those connections and have all of those conversations with your patients. So your team is 100% that we all have to be rowing in the same direction. And so sometimes I think that, yeah, we kind of get off track. But when you're passionate about what you do, and when you see the impact that it has on the community and on your patients, and when your patients come back and they tell you that they learned a lot, or you really made a difference, I think sharing that with your team and showing what a difference that they can make really helps reinforce the model. And absolutely, your team is your absolute biggest asset. We would not be where we are today without everyone on the team feeling the same way and being as passionate about being a primary care facility as I am.
Yeah, it's fabulous. Excellent. So Ternom, you've described your practice in some detail. Wondering if you can share a specific scenario where you've had a significant impact on a patient and really leveraged both your practice site and your practice model, as well as your scope, to have a significant impact on a particular patient.
Yeah, so this is more just about, I using lab work. So we had a patient that had an appointment, and their potassium was actually pretty elevated. For some reason, the lab had not called our receptionist to let them know that this is a stat report. And it was an unlucky situation because our physician was actually off that day. And his father has passed away, so he wasn't actually behind his laptop or computer checking the lab work that come in. And so when I was just going through his chart, looking at his lab work, looking at his LDLs, I came across the potassium. And so obviously, as everyone knows, high potassium needs reassessment, either go to the ER or have it redone. So I was able to actually, using our virtual platform, I was able to get him in a virtual appointment to speak to another one of our physicians to have his lab work redone. And I think this, obviously, like, everything worked out really well because his potassium had come back down with the second test. But I think just little things like that as a pharmacist, you are able to identify. It doesn't necessarily mean that I'm going to action it. Of course, I needed a physician to order more lab work for that patient, but just identifying that. And it was on a Friday, so if maybe over the weekend, had that not been caught, it would have been a worse outcome for the patient. I think little things like that, it's not always huge things that a pharmacist can do, but even little things like that have a huge impact on the patient. And when he came in, he was so appreciated. He was thanking me, like, thank you so much for organizing the virtual consult. Just like that, like Stephanie mentioned, when you see the outcome, no matter how big or small they are, that's what really makes your day and gives you motivation to continue doing what you're doing.
Great, thank you for that, Taranum. And Caitlin, how about you? Could you think of a particular instance where your model, the way in which you practice, has had an amazing or a significant impact on a patient?
Yes, yeah. I think, every day we're fortunate to have some type of intervention that we're able to make a positive impact. But one that sticks out for me is sitting down, reviewing a patient's medications while enrolling them in the Simple program to simplify their medication. And really, we started to talk about their diabetes control, side effects, that type of thing. And from there, we noticed that a patient, they thought that they were having complications with their prostate. But in the end, it was actually a side effect from one of their medications. So making that recommendation to their physician and knowing the physician well, and instead of just making the change, ourselves, we picked up the phone, we talked to the doctor, made the recommendation. And from there, the patient came back a week later and said that it changed their life entirely, that they were able to go longer than 15 minutes, like on a drive with their family, and it wasn't so much of a burden. That embarrassment was gone, and just to have that point of care. I think as pharmacists, sometimes we underestimate what we can do for our patients by making a simple recommendation.
Yeah, absolutely. Yeah, I think you're absolutely right, Caitlin. And I think that we often underestimate what real impact we're having on patients. And I guess this question, is to anyone who'd like to answer it, but we, I think often we're asked as an association, well, what is the impact of pharmacists? And there's so many great examples, but we don't often capture it in sort of an aggregate form in terms of, well, of all the clients that come into our store with hypertension, we've on average managed to lower their blood pressure by 10 milligrams of mercury or something like that. And I'm wondering if you have any thoughts or any experience where you're sort of capturing some data on an aggregate as to what, the significant impact that you're having in your practices, and if you're not, maybe comment on how we should perhaps find ways to capture this so that we could truly tell people the impact that we're having. So Taranum, I see you nodding, and I'm wondering if you want to sort of start us off with this question.
Yeah, I've had thoughts about this for a long time, because honestly, I've seen it with my own eyes, what impact our pharmacy team has and how much would help our physicians. Dose adjusting metformin when their EGFR drops, increasing the dose of their Jardiance, for example, because their A1C is still high, dose adjusted insulin, all of these little things that we do day in, day out, that doesn't really get captured. Like, I'm pretty sure that if we do a research study on this, we'll find like amazing improvements in A1C, amazing improvements in blood pressure, in their fasting blood glucose, in their LDL. But we fail to do that, right? We fail to kind of capture all this data. It's happening, but in the background. And I've always thought about how can we capture that. I know there's like studies that were done. I've seen that where my student and I were looking at it. Having a pharmacist on the team versus not, and glycemic control or blood pressure control. But for myself, I don't know how I would be able to do that in my practice, but it's definitely something that I think is valuable if it was captured, because then it actually showcases the impact on patients and the significance of it.
I think that's such a challenge. Like, as pharmacists, we're so humble in what we do in the day to day. And, you know, like I said, we underestimate how a simple recommendation can impact a patient's quality of life. And I think it's so hard to capture that because so much of it is just patient feedback. And as well, like, you know, sitting down, we'll often talk, you know, we did X amount of care plans, and from that we've made so many recommendations, and it would be phenomenal to see that, you know, amalgamated into a solid piece of information. And I think we'd be blown away exactly by the caliber of impact that we have, but it's hard to make that into tangible data at times.
Yeah, and to your point, I think it's hard to really measure outcomes. It's hard to determine because we don't truly know the value of a conversation that the patient perceives. We may be counseling, it might just be day-to-day counseling or day-to-day conversation for us, but that could be super impactful on the patient. And we might not always know that. Some patients come back and give you feedback, but some patients just walk away and to themselves, "Oh, I didn't know that." So sometimes we don't know what pieces of the conversation that the patient is pulling out, and then that's making a change for them.
Sorry, that it is a challenge that we have as a profession, most definitely. So I guess changing direction a little bit, Stephanie, you talked about this a little bit in your presentation, but I'm sure there will be people that are inspired by all of the examples today and Health Hub in my practice. What are the first steps that you might suggest to them in terms of getting started?
Yeah, so I believe that this is attainable for any pharmacy that kind of wants to rally their team and get everyone rowing in the same direction and really bring this vision to life. You just have to have a love for patient care. Really, at the end of the day, you have to be so focused that the patient outcomes and the patient is going to end up better for their interaction with you or with a pharmacy assistant or with a technician. Anyone they come in contact with, they should walk away better from that. The number one thing that I think is really important is using counseling rooms. I think that we're saving counseling rooms for really awkward conversations. And then patients also see that. So if they know subconsciously that they're only being pulled into the clinic room if we're talking about an uber private medication, or we're only using it for if you need an immunization, then they start to not want to go in the clinic room. But we use ours all of the time. Like, I might be counseling on amoxicillin and I'm in the clinic room for that. And I've seen the change in patients just over the course of 5 years. Now they actually come to the counter and like, can I see you? But can I see you in the room? And so it's incredible. Once you see that shift, you can start now bringing people in the clinic room. They want to go in and have conversations with you. And I think that that's really when you get bigger opportunity to educate and to make positive change for the patient, because you will talk about a lot more. You will get a lot more out of your patient when you're behind closed doors and when they're comfortable and confident speaking to you. So if you're going to do anything today, I think it's about just starting to use your clinic room, and just it's an extension of your dispensary. Get your patients used to pulling in the clinic room. So it's not like a foreign concept or only for like serious conversations, we'll say.
Great. Thank you for that, Stephanie. Caitlin, how about you? Do you have any thoughts about people who are inspired to get started? What might be their first steps?
Yeah, and I think it's important to keep in mind as well, you know, we pride ourselves on being healthcare hubs within my model anyways, but there's days where it feels like all I've done is just dispense, and it's that traditional model. And I don't think that ever goes away. It's just adapting. And so starting it one day at a time, taking that extra 5 minutes with that patient, making the person that is in front of you feel comfortable, and just taking that extra time to make them feel at ease, and to prove exactly the information that you're giving and how reliable you can be. I think that our accessibility is a blessing, but at times it can feel a bit overwhelming because there's so many things coming to us at once. But I think keeping that time and focusing on the relationships, we don't have to jump to being healthcare models or healthcare hubs 100% of the time. But if you have that foundation of, I want to make a difference for my patients, I want to establish those relationships and show exactly where I can make a difference. It doesn't have to be with every prescription to start with, but start with one a day, increase forward, and you'll see that word of mouth and the patient value of that relationship that much more.
Great. Great. Thank you for that. Coming back to you, Caitlin. So one of the things that I think is really important that pharmacists do, and something that you, I believe, touched on a little bit, I'm wondering if you could expand on it, is your triaging component. So reaching out to other healthcare providers when you realize that a higher level of care is required. Do you have a formal mechanism of doing that, or existing relationships where the prescribers may realize that you're sending patients to them that they require added attention? Do you have a formalized triaging or referral process?
So we don't have a formalized process for all of our encounters, but I think we have such established relationships with the majority of our colleagues within the community that we have that comfort level, especially with our primary care network, utilizing the nurses, utilizing the most accessible within that network as well, recognizing that their time is valuable, but picking up the phone and taking that 2 minutes to say, hey, I have a patient here. I'm not really sure what to do. These are the concerns. Can I refer them to you? Can you send a note to the doctor? Can you book them in? And I think from there, it's vice versa, because then they pick up the phone. Hey, I have a patient with a medication question. I'm not sure what to do therapeutically. Can I send them to you? And I think having that back and forth relationship and almost an informal referral process of, I recognize what you can do, what you add to my patient, that we are a team, and referring back and forth that way. We do have more formal processes with like dietitians and things like that, with forms and sending information and referring to some of the healthy living programs through Alberta Health. But overall, it's that network of connection that we have. And then I think from there too, by referring back and forth, patients recognize that they can even refer themselves or refer their family member to have an appointment with their pharmacist. And I think that that's also part of, with the last question, by taking that extra time, people recognize, hey, when is a good time for me to sit down and talk to you? Do you have 15 minutes? And it's so interesting how that relationship flips, that it's not us always seeking to prove ourselves, but it's that the patient recognizes exactly the value that we add, and that continues on into our interprofessional collaboration as well.
Excellent. Thank you for that. So Taradam, I think you've really described in a terrific way the impact clinically that you've had on your clients. And one of the questions that I'm curious to ask you is, how have your patients responded in general? Because they may have a very definite picture in mind of what a pharmacist does, and your practice is quite different. So I'm wondering how they respond to that. They're surprised. I'm sure they're pleased with the service that you get from them, but maybe you could describe that a little bit.
Yeah, I think surprise is a good word to explain them. So normally they wouldn't really expect the pharmacist being on the clinic side. So, when I'm sitting in the clinic discussing things with physicians, they see it, right? Because the physicians also are in that environment. Other than that, I think Caitlin and Stephanie both kind of alluded to it. It's really important that you show that you truly care about them. When you show that you care and you have passion for what you're doing, the product of it or the fruit of it, they'll actually understand that, whoa, like they're actually really like caring. This team is actually really looking out for me. So like, for example, at the beginning, when I would, maybe call them and say, hey, I'm calling from Dr. X's office. I just wanted to quickly review your medications because the physician has asked me to do so, for example. They're like, oh, like I have my own pharmacy, right? And so some patients do have their own pharmacy, which they don't even get their meds from us. But I think like slowly with time, and as well as, having the physicians kind of implement this practice, they've kind of gotten used to it. They've warmed up to it. So just because I'm not their dispensing pharmacist doesn't mean that I can't help in their medication management. And so, we've also had physicians who explained to the patients that, hey, like you might have a pharmacist call you because, you know, I just want a review done on your medications. I think at the beginning, it's very surprising to them because they're normally just used to having a pharmacist count their pills and give it out. But once you start talking to them about insulin adjustment, or hey, what was your fasting blood glucose yesterday, for example? Hey, what is your diet like? Maybe I can refer you to a dietitian. Those things, when you start doing it and then they're like, whoa, they actually care. I think that's when they start to warm up. But for sure, it's very like surprising for them to see this kind of role, because again, in Ontario especially, you don't really have access to lab work. So when I bring up that discussion, hey, I noticed your A1C was elevated, they're kind of like, oh, how did you have, like, I didn't know you've seen my lab work. So all of that is very surprising to the patients, but it does at the end, when they see it, you know, have its great impact on their health and that we actually care, it's really rewarding because they really appreciate it.
That's fabulous. I think a lot of people who are listening today are probably, you know, in a way somewhat envious of the practice style that you have, because they, you know, for a lot of people, a lot of us as pharmacists, that's how we would like to practice. So one of the questions that came up, and I think I'll direct this to Stephanie, one of the questions that it's going to come up is that with the desire to practice in a certain way that a lot of pharmacists have, how do you balance that with the needs to have a healthy bottom line to keep your practice viable? How do you maintain that balance? And has that ever been a constraint, or are you is it a chicken and egg situation where practicing in a certain way has even enhanced the bottom line?
Yeah, so I'll echo Caitlin in the idea that it's always care before commerce. And when I designed Complete Care Pharmacy, I wanted to do that because I wanted to practice the way that I wanted to. I wanted to spend time with patients in the clinic room going over their medications. And I've just believed that by doing that, through word of mouth would grow the pharmacy business. And as Taranam said, some things are just not reimbursable, but I believe that they will be in the future. So I'm going to keep doing it to keep showing what a pharmacist can do. And so the services that are reimbursable, sure, we focus on those. We try to make sure that we incorporate those into our practice. As Caitlin said, we're still dispensing every day. So we're not only doing pharmacy services all day long. We are still dispensing besides. But I think that it's a healthy blend of conversations, some reimbursable services, dispensing, and then some is just about pushing the envelope, doing the things that are not getting reimbursed, but having full belief that down the road they will be. If we keep doing it and showing the outcomes that we're having, then we'll move the needle forward on that. So it's a combination. It's a balance.
I think as well with that is as we continue to advocate for the profession and exactly what we can do, I think that our scope and the remuneration model will transpire with it. So it's taking time to really, again, prove our worth and show exactly what we're doing. And I think the pandemic has pushed the envelope even more to show that we have been the ones to stand up. And, you know, across the country, it's been different in terms of pharmacist participation in vaccination, but the fact that we're at the table having the conversation that pharmacists at some point are providing the vaccines, I think over time it's hopefully going to be standardized across the country, but we have to continue doing those things, but being loud with the fact that we add value, we make a difference.
I think you've raised a really good point, Caitlin, and I think you know, by doing what you suggest, I think we will probably accomplish both aims in terms of really fulfilling ourselves professionally, but also having a viable business that can continue to be sustainable. So one of the questions that has come up is in terms of, and maybe I'll direct this to you, Caitlin, is with the education that you received, were you did you feel it was a natural then to work within this practice model that you've described, or were there any other skill sets that you felt you needed to get in order to be effective in the role that you had envisioned?
I think, coming from a Saskatchewan education to Alberta, where the scopes of practice are a bit different, it was that discomfort. I think every pharmacist feels that as well when they first continue on into their career as a new grad. There's like almost that fish out of water experience where it's on you. And I think it's just becoming comfortable in being uncomfortable, making those judgment calls, acknowledging your competence and your knowledge. But I think there's also a lot to be said about networking within pharmacy and utilizing our connections and educating ourselves on what other pharmacists are doing. We're very lucky that although we're humble, we have so many incredible pharmacists with such different practices that we can kind of pull on each other to really get that knowledge and that connection of what are you doing for this? How do you make it possible? And I think educating yourself about the differences in everyone's practice and kind of taking that and running with it, providing support to our colleagues, and then also learning from each other has been one of the biggest educational opportunities. We all became pharmacists to help people and to make a difference. And I think we have a love for the profession, or hopefully we do. And we're very fortunate that I don't think we talk enough about educating ourselves with each other and our unique practices.
Great, thanks. And Taranam, how about yourself? You work with a number of different health providers. Did you feel that going into that environment, you were fully equipped, or was there a learning curve for you to really understand what they did and how you would interact with them?
Yeah, so of course, there's always going to be a learning curve right after when you get graduate, like Caitlin said. But what I've done is I do a lot of continuing education. So for example, we have an addiction doctor at our clinic. So of course, learning about mental health and addiction was like extra courses that I took. We're going to be opening up a compounding lab, sterile and non-sterile. So, that's a whole new world, and taking courses for that. So I think there's always going to be a learning experience if you want to stay up to date, for sure. Right. But I think what's most important is having that passion. When you have passion for what you do and you see the outcomes in your patients, that really gives you motivation. So when I first started, for example, the role of the pharmacist wasn't as highlighted as it is now, right? Even within the same clinic. But slowly, after a year or two, I kind of carved out a new model for myself, right? I started doing things that weren't done before. I started trying new recommendations, new roles, just pushing those boundaries until the physicians kind of got used to it. So I think my advice to my students is always wherever you work, try to carve out the best work model for yourself and how you feel like you can have the most impact. Because whenever you join a team, it's not going to be the perfect work environment for you, right? But you can make it perfect. You can talk to your colleagues. You can carve out new work strategies. So I think other than education is just really having that passion to kind of create new ways of impacting patient care.
That's great advice, actually, and I think something that all pharmacists can definitely take to heart. Stephanie, a question for you, and that is that, we talked a lot about various factors that play into supporting this type of practice model. Are there any other factors, either internal or externals, for example, in Newfoundland, that have facilitated your practice model, that made it particularly attractive for you to create this practice model?
I guess just the camaraderie between all of the healthcare professionals, just having the opportunity to interact with everyone. Previous to this, and as Taranam had said, in many community pharmacies in Ontario, you're just kind of operating all by yourself. And so the opportunity to create connections with other healthcare providers and make us a bigger part of the healthcare system, I think has really made this a viable option, but also something that adds a lot of professional satisfaction, because even though I'm the only pharmacist in my pharmacy, I'm not alone. I have a host of healthcare professionals to speak with and to refer to. And as Caitlin said, our grander scheme of pharmacists and being able to reach out to pharmacists that are practicing in specialties. So oncology pharmacy, long-term care pharmacy. So the camaraderie that comes from having this type of model where we're connecting with other healthcare professionals, I think has really been a highlight for me.
Great. Excellent. Thank you for that. So we had a question that came up in the chat, and I'll direct this to anyone who feels comfortable answering it. So the healthcare hub is really a new, relatively new in pharmacy practice. So there aren't a lot of technological or administrative tools, such as that we have Kroll for dispensing, for example. With this particular model, and I think Taranam, you've described some of the technology, but with there's more documentation, referrals, medication directives, care logistically that you feel exist right now that need to be overcome in order for you to be more efficient and effective in your role. So I will put that out there for anyone who wants to respond on our panel. So I guess, the question is does the technology that we have or that you have access to, does it really facilitate you working to your most effectiveness, greatest effectiveness, or do you find it lacking in some regards? And there's really a technology enhancement that we haven't really identified yet that would really facilitate your practice even more.
So maybe if I understand the question correctly, obviously there is more work when you're doing more, like there's more documentation when you're doing more stuff. And one of the issues of pharmacy is that there's a lot of documentation that needs to be done. So right now, the challenge for me is that I have Oscar as our EMR, and then I have Kroll as our pharmacy software. So there is no link between the two, right? So when I do review of lab work, I'm doing it on Oscar, and when I write my DAC note for the physician, I write it on Oscar. But there's no connection. So on Kroll, it's like nothing has happened. So it's kind of like double the work for me, because if there is a pharmaceutical opinion that I want to, have on Kroll as well, I have to copy the same thing onto Kroll. So I think for us to become more integrated with other healthcare providers, I think those softwares do have to be merged for it to be one, right? So the lab work does come up on Kroll, and you're able to see it, and the DAC note that you wrote is connected, and both parties can see it. I'm not sure how it is in other provinces because they have access to lab work, but that's the issue I have in Ontario, is that basically I have to do things twice, once on Kroll and then once on Oscar, for example.
I'll speak to Newfoundland. So for our lab work, it's in a different portal. So I have to log into that portal, pull up that patient's blood lab work or reports. And then if I want to document that in Kroll, then I have to do the extra step of actually going into Kroll and typing in those results. So they don't talk to each other. But sometimes technology can make things a bit more frustrating. Like I still like putting pen to paper, and I know the physicians and the healthcare providers that I'm speaking to, so I can kind of adjust my language or my DAP note that I'm sending. But sometimes I just find it easier to just jot out my notes, send it to the physician, and then keep a copy on Kroll as well. So I got a lot of scanned documents.
We're the same. We use a lot of scanned documents, but I think familiarizing ourselves with what we have available, like Kroll does have quite a few features that we just have to familiarize ourselves with. There's charting features that, we can input blood glucose readings, blood pressure readings, and further documentation within that. With Alberta practice, we're fortunate that we have NetCare integration into our Kroll system, and we can upload our care plans to the patient's NetCare, which the lab values and prescription records and everything like that are all under the patient's profile. It's just subcategorized. So we are fortunate to have that connectivity that way. But I think familiarizing yourself with the tools that are available, Kroll, any software can be frustrating, but I think once you develop a system that works for you and your team, then it can be a little bit more manageable.
Great, thank you for that. So, it sounds to me like things are not perfect, obviously, and there's some duplication with respect to various systems that we use. But perhaps that raises the question of introducing innovation into our profession at a quicker pace, so that will allow those pharmacists such as yourself who are practicing in these models to really make their time most effective, because duplicating effort makes us all less effective in our roles. So I thank you for your response to that question. It was a good question. I think that came from our those of us who are those people listening out there today. We did have a question. I think Terranum, you mentioned doing virtual calls, and we had a question from one of our listeners that doing a virtual call by cell phone is a bit challenging because not everyone likes to give his phone number to everyone. How do you solve this issue? And I think it speaks to the greater question of how do we, within the environment that we're in terms of privacy, how can we accomplish what we need to do professionally and at the same time protect the privacy of our clients. Terranum, do you have a thought about that?
So is the question about us giving our cell phone or them giving their cell phone?
It could be. I think it could be taken as both. I think there are some pharmacists who'd be very reluctant to give out their cell phone and then have the virtual call, but then maybe be called later or whatnot.
So when I was working for Cover Health, when I was managing that, the only solution that I really had was to make my number private because I was using my own cell phone and there was patients, we would see 300 patients a day, right? So that's what I would do and that's what our physicians were doing. When I'm here and in our physical clinic, I use the clinic line most of the time. So, our name comes up. I think the solution to that would be maybe having a work phone. I know that a lot of my friends who are in pharma, they have a separate work cell phone. That would be a solution because in that way, at least the patients can access you, but at least it's not your private number either. So that's what comes to mind for that question.
Great, excellent. Thank you for that. So I guess at this point in the webinar, I'd like to go. You've given us a lot of great information. You've given us a lot of great tips that pharmacists can use, especially those who are considering this type of model in their practice. So starting with you, Terranum, and maybe reverse alphabetical order, how do you have any parting thoughts, any parting ideas that you'd like to share with our webinar listeners today?
Yeah, I think a lot of people, if they're listening from Ontario, like you said, they're probably thinking, oh, you're very lucky to, have this kind of work environment. Not everyone can achieve that. But I think honestly, if you have the passion for what you do and the passion to make an impact for patients, you're able to carve out something for yourself. Like I mentioned, this wasn't the model I was in when I first started. I carved it and I carved it and carved it until I found the right kind of balance for what I do. And of course, this is always changing and I'll probably do other stuff later on or change something that I do right now. But I think just having that passion to carve out a model that fits your personality, your mindset is really important. So just having that passion and not settling for a job that doesn't make you happy. I think that's really important because oftentimes we fall in that habit. Well, this is my role and this is what's defined. But what's defined doesn't mean that it can't change. You can change that and you can push for the things that you really believe in and you're really passionate about.
Excellent. Thank you. Thank you very much for that, Terranum. How about you, Caitlin? Do you have any final thoughts that you'd like to share with our listeners today?
Yeah, I think it's one day at a time, recognizing your role within the patient care and focusing on relationships. I think that passion shines through if you genuinely care and if you're dedicated to your profession. We should believe in ourselves and what exactly we're adding to the healthcare model. And from there, it's relationships not only with our patients, but with our staff. As the profession of pharmacy, we're so fortunate to have registered technicians as well as pharmacists and our assistants, and utilizing them and empowering them to use their full scope as well so that pharmacists can be clinical. Really, taking the time to develop that team approach as well. And that interprofessional collaboration really doesn't, I think it shouldn't be going unrecognized in terms of the value that you can add just by picking up the phone and creating that trust and advocating for exactly what you can do and what you can add to the patient outcomes. Relationships, I think, are one of the fundamental aspects in a successful community pharmacy, and showing that you are an essential part of the community.
Excellent. Thank you for that, Caitlin. So Stephanie, you have the final thoughts. So what would you like to say to our those who are joining us today?
I think my biggest takeaway would be to believe in yourself. If you have an idea in your head, if you have a practice model that you'd like to move into, if you have bigger dreams for your career, then it's absolutely about believing that you can. It will be uncomfortable. As Taranam said, you're always pushing, but you have to push the envelope. You have to get outside of your comfort zone. And it's beyond that comfort zone is where you really find the magic will happen. And that's when you really find that career that you believed was in there all along, but you can't stay where you are. You have to push a little bit outside to get there.
Great. Thank you for that, Stephanie. On behalf of CPHA, I have to say that it was so impressive listening to you and hearing the passion that all of you as presenters had today about the practice that you've created. And I think there's a lot of excellent messages in there to really inspire pharmacists to try and do more and to create a practice that they truly feel passionate about. So on behalf of CPHA, I'd like to thank you for joining us today and sharing your experiences with us. I'd like to thank everyone who has joined us today for our webinar also for attending, and thank you for your great questions. Before you leave today, I would ask that you complete the evaluation at the end. CPHA benefits from your comments. And we're constantly trying to make our webinars better and also address topics that are of importance to pharmacists. So please ensure that you complete the